Let's study the mandible. Yes, it's the only bone which is movable into the skull. Yes, it is forming which joint here? It is forming a temporomandibular joint, right? Okay, now let's study the mandible. It is the only one bone. Yes, that's why no need to do the side determination. Now, parts of the mandible. What are the parts of the mandible? Two main portions. One that is known as the ramus, and another that is known as the body. So, ramus of the mandible and the body of the mandible. We have two processes onto the ramus. This process and this process. Yes. So, this process is known as coronoid process, and this process is known as the condylar process. Now, the condylar process, upper portion, that is known as the head of the mandible. And between these two processes, there is one notch, and that notch is known as the mandibular notch. Yes. Under the ramus, we also consider two surfaces. One that is the lateral surface, another that is the medial or inner surface. Yes. Onto the inner surface, remember one tongue-like projection. Yes. That is known as the lingula, and inside there is a foramen, and that foramen is known as the mandibular foramen, and inside there is a mandibular canal, and that canal is opening onto this foramen, and that is known as the mental foramen. Remember, one nerve is inserting or going from this portion, that is known as the inferior alveolar nerve, which is the branch of the mandibular nerve. This is passing from here, supplying these all the teeth, and then come out as a mental nerve from the mental foramen. Remember this thing. Now, onto the inner side, yes, onto this portion, this line. That line is known as the mylohyoid line. Yes, and it divides the mandibular portion into the two parts. Upper part, we have one fossa that is known as the sublingual fossa, and lower part we have a fossa that is known as the submandibular fossa. Yes, remember, sublingual and the submandibular fossa. Now remember, onto this portion we have one tubercle, but there's a pair of tubercle. Yes, those tubercles are known as the genioid tubercle, and from the genioid tubercle, yes, there are two pairs, basically superior and inferior. From one side the muscle going to the tongue, that is known as the genioglossus, and from another side it is going down to the hyoid bone, that is known as the geniohyoid muscle. Let's revise fast. Ramus, body, and this portion is known as the angle. And onto the ramus we have two processes, one that is known as the coronoid, another that is the condylar, head of the mandibular notch. Onto the inner side we have tongue-like projection, lingula, foramen, mandibular foramen. Yes, line that is known as the mylohyoid line. Then we have two fossa, upper part sublingual and lower part we have a submandibular fossa. Onto the inner side we have tubercles, those known as the superior genioid tubercle, inferior one from where the muscle originating genioglossus and geniohyoid. Mylohyoid also origin from both the side, and it forms the one raphe here, that is known as the mylohyoid raphe. Okay, now remember this process all known as the alveolar process of the mandible. Yes, and here that known as the tubercle. Yes, what that tubercle is known as the mandibular tubercle. You can pause. Onto this part we have two mental foramens, and these two elevations known as the mental tubercle, and here that is known as the mandibular groove. There is a slight groove portion is here, that is known as the mandibular groove. Now, most commonly asked attachment onto the mandible, those are the muscles of mastication. And remember the attachment of those muscles of mastication, there are four muscles, 2M, one outer side and another inner side. That's how the outer portion, that is known as the masseter, and inner side we have the medial pterygoid. So 2M, That is one, that is the masseter, and inner side that is known as the medial pterygoid. Now another two important muscles, one onto the coronoid process, that is the temporalis, and onto the condylar process, here we have a lateral pterygoid. So now four muscles of mastication. This side there will be the masseter, yes, onto the inner side we have the medial pterygoid, then here we have the temporalis, and here we have the lateral pterygoid, yes. So remember all the muscles of the mandible, four muscles of mastication, then from here onto the genioid tubercle, genioglossus, from the genioid tubercle to the hyoid bone, geniohyoid, and from the mylohyoid line both the side we have the mylohyoid muscle. Yes, let's discuss onto